Hi, my name is Sarah Lehmer. I'm shooting this video because 5 months ago, I was looking for a solution to address the underlying issues that caused my breast cancer to start in my body in the first place. And Katrina's program has given me the peace of mind to eliminate and reduce my anxiety because I believe that I am taking action to reduce any further chances of breast cancer recurring. I highly recommend the Cancer Freedom Program because it addresses the root cause issues of my specific breast cancer. Hi, my name is Sarah Lehmer and I live in Wilmette, Illinois, and I was diagnosed with stage 1A breast cancer in November 2022. So I do work with an oncologist, and I had a double mastectomy last year in 2023. I also did 8 rounds of chemotherapy, and I currently take an aromatase inhibitor drug also. So those were the big things that I had done before working with Katrina. In addition to that, I'm also like a health and wellness podcast junkie. So I would listen to a lot of podcasts, specifically if anything was cancer related or healthier living related, that would really catch my eye. Things that were going through my mind before deciding to work with Cancer Freedom were a lot of stress and anxiety. In fact, I've been working with 2 different therapists to try and get over my fear and anxiety of recurrence. It is constantly there in the back of my mind, especially because I'm a single mom with sole custody of 2 kids. I need to be here for them. And so I was always stressed and worried about it. And I had gone through, like I said, working with a therapist to do cognitive behavioral therapy, which helped to an extent, but I would say it was still kind of always in the back of my head. Like, when I'm off of these drugs and off of this medication, who's to say that this can come back and recur? Katrina was on a podcast with Wellness Mama, talking about her story and kind of 10 trigger categories for minimizing breast cancer risk of recurrence, which really caught my ear. It really made sense to me when she talked about testing and doing the blood test, urine test, stool test, saliva test, all the things to test in all the different categories like hormones, cortisol, toxins, you name it. And for the first time, I just felt like her proposed solution made sense to me. I would say the biggest 2 takeaways for me since I started the program earlier this spring have been that the vast majority of women with breast cancer have 2 things in common. 1, most of them are on the verge of insulin resistance and have very high blood sugar, which I've learned that I did and I do. And 2, that nearly all women with breast cancer have had toxic levels of mold exposure. So I didn't know either of those 2 things, and Katrina has given me solutions to put in place to deal with both of those things. The advice that I would give to somebody is to take a close look at Katrina's program because it is really customized and tailored to you as an individual. She does all of this individualized testing that gives you results and a customized plan using her established process to help me identify the weaknesses in my body that allowed this breast cancer to proliferate. I think that's just extremely powerful, and I would also encourage you to talk with her, ask any questions that come to your mind, as she has always been extremely open and patient in my experience of working with her.